preterm baby is defined as babies born alive before the 37 weeks of pregnancy is completed. There are subcategories of preterm based on gestational age. This consists of the extremely preterm, the very preterm, and the moderate to late preterm. Prematurity is a global problem and is the leading cause of death in children under 5 years old.
Newborn mortality rate of the Philippines in the 2017 National and Demographic Health Survey revealed a 14 per 1,000 live births. The leading cause of newborn mortality in the Philippines are complications of prematurity and low birth weight. Approximately 40 to 45% of these newborn deaths are attributed to complications of prematurity and low birth weight.
The impact of maternal health can't be overemphasized. Mothers with hypertension, preeclampsia, diabetes, bleeding disorders, and infections like UTI are prone to give birth to a preterm baby. There are also other risk factors that increase the likelihood of preterm labor. Therefore, every mother must have adequate prenatal visits of at least 4 times during her pregnancy, together with appropriate counseling. All fetuses must be carried to term as much as possible. If the mother is at risk for preterm delivery, antenatal corticosteroids must be given for its certain benefits. Provision of magnesium sulfate and certain antibiotics must also be used for the best care. Despite all the measures to address preterm labor, there are still clinical circumstances where preterm delivery cannot be avoided. However, there are also practices that can optimize neonatal survival.
The seeds of essential intrapartum and newborn care germinated in 2007 when formative research in 51 government hospitals documented inappropriate practices that were interfering with breastfeeding initiation. By 2009, the Administrative Order on EINC, more popularly known as Unang Yakap, was signed by then Secretary of Health Francisco Duque. By 2010 to 2011, this package of time-bound interventions in the labor, delivery, and immediate newborn care period was being implemented already in 11 government hospitals. In the seconds to minutes after birth, this rapid sequence of immediate drying, skin-to-skin contact, properly timed cord clamping, and non-separation of the newborn from his or her mother should be done in all healthy newborns, whether term or preterm. Early impact on outcomes consisted of reductions in NICU admissions, increases in breastfeeding rates, and at the population level, newborn mortality rates that declined faster than before.
Kangaroo Mother Care started in the Philippines at the Dr. Jose Fabena Memorial Hospital in the year 2000. Over the years, this program has been implemented in various hospitals, both government and private hospitals in the Philippines. Kangaroo Mother Care subsequently has been adopted by the Department of Health in its Care for Small Babies package of interventions since 2014. The past 5 years have shown a greater impact on the low birth weight population, not only on survival but on the quality of life. At present, Kangaroo Mother Care is being cascaded down to the community in various regions in the country, and the service delivery network has been very instrumental in this regard.
Kangaroo Mother Care, or KMC, is a low-cost, high-impact intervention endorsed by the WHO for the care of the small babies. KMC is composed of 3 parts. The first one is skin-to-skin contact between the mother and the baby on a vertical position. Second is continued breast milk feeding, either by direct latching, tube feeding, or cup feeding. And the third is early discharge from the hospital and early follow-up.
It is also important to note that other members of the family are encouraged to do KMC as well.
Breastfeeding has the highest contribution to prevent child death among 5-year-old children.
Delaying initiation of breastfeeding would double or quadruple the risk of infection-related deaths. It actually saves 2 lives, the life of the child and the life of the mother. Breastfeeding reduces the incidence of breast and ovarian cancer as well as non-communicable diseases such as hypertension, stroke, diabetes, severe uterine bleeding, and postpartum depression. It is considered the first immunization of a baby. It contains unique antibodies that the baby and other children need against infections. And it also prevents all kinds of malnutrition, including obesity and other non-communicable diseases like diabetes, hypertension, stroke, and cancer. There are different baby positions that a baby can breastfeed depending upon the comfort of the mother and the baby. There's a cradle position, cross cradle position, and underarm position.
We are celebrating the World Prematurity Day on November 17. This is a big event for us because we will focus on the premature. We are having an increase in the incidence of prematurity here in the Philippines at 13%. The simplest thing here is that we manage the newborn immediately through Kangaroo mother care and EENC or Essential Newborn Care with exclusive breastfeeding.
Hello po!
Hello po!
Hello po! Ang kasama ko po yung anak ko na si Samuel.
Siya si Maria Sofia.
Ayun yung kids ko po si Trisha May. Pinanganak ko po siya ng preemie, 29 weeks and 4 days.
Ako ay nanganak na 7 weeks.
28 weeks. 31 weeks.
Ngayon, nasa 2 taon at 5 buwan na siya.
Ngayon, nag-1 taon na yung anak ko.
2 years and 5 months na po siya.
Papasalamat po ako at umaki ng malusog at matalino ang aking anak.
Sobrang healthy and malakas po siya. Sobrang kulit niya po. At salamat sa Diyos, malakas na bata siya. Mabilis yung kanyang pick up, yung development niya.
Maraming salamat po.
Maraming po salamat.
Maraming salamat po.